Good morning. We are going to convene the April 21st, 2020 Scott County Board of Commissioners meeting. If you join me in the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Item number 2, amendments to the agenda. I don't see any amendments, so the agenda will stand as distributed. Number 3, approved minutes of the April 7th, 2020 County Board meeting. Are there any changes or additions or clarifications?
Mr. Chair, I'll move approval.
A motion and a second. Any discussion? Otherwise, we will be looking for roll call votes.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
Thank you very much. Item number 4, recognition of interested citizens. Always a highlight, allows anybody to come in and address the board with any issue that is not on the agenda, and I see someone approaching. Good morning to you, sir.
Yeah, good morning.
Just gonna set my timer, but again, I don't know if I have to, because you've got this. I'm gonna calibrate my clock to your time.
To
because
my
it's-
time,
yes.
okay, good. Well, I already got mine running too. So good morning, everybody. John
morning.
Weiser. Pleasure to see you. I have, obviously, as you guys know, I've been coming here for quite a while, since 2017. And I've been, my most recent piece I've been talking about is the basic fraud. And as public servants, you guys took an oath to serve the public. And you guaranteed that you would secure the rights according to Constitution and according to statute. I've been providing notice that on Minnesota Statute 171.186, which allows the Commissioner of Transportation Public Services to suspend a person's driver's license upon receiving a notice from the public authority. And there has to be 2 conditions precedent before they can suspend. They don't have 2 conditions. In fact, one of the conditions doesn't even exist. A written agreement has got to exist in order for the commissioner to suspend. So I've got a notice that I've copied to the commissioner, that I've copied this board. You guys, I'm sure, are well aware of the separation of powers doctrine. The legislature, where Mike had served us before, creates the rules. The executive branch executes the rules. The executive branch is not allowed to execute rules that have not been legislated. Separation of powers doctrine. That's exactly how it rolls. So I'm giving you notice that this has not happened. That, in fact, this board here is actually funding Jolene Anand, Ingrid K.K. Dixon, who have provided a notice to the Commissioner of Public Safety that doesn't comply with Minnesota Statute 171.186. It doesn't exist. So you're either with the public or against the public. You're either serving the public or you're serving the public employees. And I'm going to ask you guys, I'd asked a month ago when I talked to Tom, I said, hey, can I get a copy of the county's liability policy? Sure, no problem. Ron's going to go take a look at it. Well, I know we've had a lot of disruption here. It's been over a month. I haven't seen it. I followed up with an email. I followed up with a FOIA request. I still haven't seen it. Just to give you an example, in 2013, I asked County Administrator Gary Shelton, can I get a copy? He was on vacation. He sent an email to Rhonda Laxon. I got a copy within 72 hours. Okay? I'm just wondering, can I get a copy of that? So I can understand the county's liability policy, and I'm also just providing a notice. And I'm done, and I hope you guys are well. So where would you like me to leave the notice?
You can just grab it. We'll grab it up.
Maybe
Yeah,
sit
either
right
on the
down. Right
desk
there?
there.
Yep,
Yeah.
okay, perfect, yep.
Yeah, shut my timer off. I've never done that before. Thank you for coming. I appreciate it.
You bet. Thank you very much. Thanks for getting me in, Ron.
Is there any other interested citizens? Seeing none, let's move on to the consent agenda. I'm going to read these items, and these are typically, have all been vetted by staff and passed with one motion. 5.1, approve the request for final plat of Crescent Curve LLC applicant and property owner. consisting of 23 lots on 85.89 acres in sections 27 and 34 of Credit River Township, and a three-way development agreement with the developer, township, and county. 5.2, approve the conservation easements of Maggie Lane Farm, Clarence Van Zee applicant and Van Zee Living Trust property owner, a subdivision consisting of 3 lots on 51.33 acres in section 27 of Credit River Township. 5.3, approve the purchase of 2 laptop-based 800 megahertz radio consoles for continuity of operations. 5.4, approve payroll processing of personnel actions. 5.5, adopt resolution number 2020-071, authorizing entering into a cooperative agreements with Cedar Lake, Jackson, Louisville, and Helena Townships for their participation in the 2020 Seal Coat project. 5.6, adopt resolution number 2020-072, authorizing the submittal and acceptance of the Minnesota Trail Assistance Grant Program application for Scott County Snow Trails, Inc. for the 2020-2021 snow season. 5.7, adopt resolution number 2020-074, approving entering into an agreement with the Minnesota Pollution Control Agency for the 2020 Local Recycling Development Grant. 5.8, adopt resolution, number 2020-073, approving the findings of fact and conclusions for the Jordan Interchange Environmental Assessment Worksheet and negative declaration on the need for an environment impact statement. 5.9, adopt resolution number 2020-076, awarding a contract to Asphalt Surface Technologies Corp. For 2020 County Seal Coat Project. 5.10, adopt resolution number 2020-077, awarding a construction contract to MP Asphalt Maintenance, Inc. for the 2020 Trail Seal Coat Project. 5.11, approve record of disbursements and approve claims. Those are the 11 items on the consent agenda. Is there any you would like polled or any other information on those? Looking to my left and right.
Mr. Chair, I would move approval of those 11 items on consent.
We have a motion.
Second.
We have a second. Any further discussion?
Mr. Chairman, just a comment, kudos to us passing the finding for the EAW EIS for the Jordan Interchange project. That's been coming for a long time. That's an important step in the process.
It is.
We get that certification out of the way, that means money can start showing up and things can happen. So, way to go. Thanks.
Thanks for pointing that out. So we have a motion and a second. With no discussion, I will look to Deb for a roll call vote.
Commissioner Weckman Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Consent passes. Thank you very much. 6.1, receive a coronavirus update. We still have that, huh? I was hoping maybe that was gone away. No? All right. Wishful thinking, being hopeful. See Captain Haas coming up to the podium. Good morning to you.
Good morning, members of the board. My name is Scott Haas. I'm the Director of Emergency Management and 911 Communication. And hopefully for the audience today, I'm actually speaking into the microphone. I got a critique on that last time. So,
Oh, there we go.
Good morning. I'm just going to briefly introduce the status of where we're at as a county in response to the COVID crisis. And then Public Health Director Lisa Brodsky will be here to provide a lot of data about where things are and how it's impacting the community. So we made a change on Monday, and we're scaling down our daily EOC operations. Our Emergency Operations Center was activated for about 4 weeks, where we had fully activated status. All of our functional positions were occupied at the time. We had people working on logistics and our planning section and finance section, all working throughout the day. As we evaluated the ongoing work of the EOC, quite frankly, things started to slow down, which is a good sign. We took a little bit of excitement and a lot of action and from the early phases of the EOC operation, and we normalized it, and things got to be routine. A good example of this is our logistics requests. Our logistics area handles requests from within the organization, within Scott County, as well as from our partners. We get a lot of requests from long-term care providers, for example. We were dealing with over 10 to 12 logistics requests every single day where people were saying they need stuff that we were processing, to over the last couple days of last week, we were down to 2 or 3. So as that reduced, being responsible in the organization, we looked at what needed to happen and we started to scale down operations. So that's what we're doing. We're going down to monitoring mode now with our EOC. We have 3 very well trained up teams that are ready to stand up should we need to do that again. But from the scalability that the incident command system and NIMS requires, when the incident doesn't require a fully scaled up operation, it's our responsibility to scale that down, and that's what we're doing. So we're still going to be functioning. You'll still be getting your situation reports every day. Our office, working with public health, is going to continue to get those out to you. But we're going to see some reduction in the amount of staff that's actually working day to day, keeping the EOC staffed up. Just want to call out one thing that I think is really important to share. One of the things we're looking at is what's the cost of this event for Scott County. Obviously, we have a lot of staff that are involved, and this is impacting everyone's worlds. As of the end of last pay period, Scott County has spent less than $3,000 in overtime costs to support this response. So if you look at that, we've had a lot of hours with exempt employees, with already budgeted hours that have been geared and shifted towards making sure we're being responsive to this incident. But we've contained that overtime to being under $3,000 at this point. And I think that's really important that the county continue to be responsive to its community, especially when we consider what's happening with the unemployment claims. Just some quick numbers, and we'll be providing you with better information in our situation report as we move forward. In January, we had 438 new applications for unemployment. February, it was 338. In 3 weeks, between March 15th and the beginning of April, that was over 11,000 claims within Scott County. So we're talking about 12 to 13% of our working adults in Scott County have needed to file that initial claim or application for unemployment insurance. So as we proceed, this, as we've talked about before, this is a public health event that has now caused the secondary event of the economic impact. A lot of our people are hurting, and it's key that as we continue to proceed, we continue to be responsive to our community and be responsible in government. And we are continuing to do that, and again, that's why we're scaling our operations to be appropriate and to match the incident.
Mr. Chair? Thank you. I just want to make one clarification for folks that are listening or for press. You talked about the overtime costs less than $3,000 for the incident, but I just want to clarify, or want you to clarify, that that's probably not accurate as far as the county's total costs, because we've had other costs related to this event and we've lost a lot of revenue. So just wanted to make sure that nobody's going to take that $3,000 number and say, oh, this is the impact on the county, because I think it's been more than that.
Correct, Commissioner Weckman-Brecky. That is absolutely correct. This has absolutely cost us a good amount of money. We have a lot of staff time that's been dedicated towards this response. The overtime is simply that time and a half. We've kept that tight.
Yes, thank you. I appreciate that, and I appreciate that that's often different than other types of emergencies that we've had in the past.
All right, so with that, I'm going to pass the chair to our Public Health Director, Lisa Brodsky, and I'm going to depart so we can get one more person in the room.
Thank you.
Good morning, Commissioner Beer, Commissioners.
Good morning.
Good morning.
Good morning. Well, I'm hoping to do what we usually do, talk a little bit about numbers. I also have my data planner here who is going to do a little bit more in-depth data analysis for you and go and walk through that and explain that. And we also have Dr. Mike Wilcox here, our medical director, who could answer any questions, specific medical questions. Starting from the world view, and I'm going to go down to Scott County, and I'm hoping you guys can hear me okay.
So far, so good.
This is from the Johns Hopkins website. This is one of the most accurate websites that have coronavirus on there. This was from last night. I'm
Mr.
sure the
Chairman.
numbers are.
Lisa, hold on just a sec. Sis.
There we go.
Is that to be up here on the screen or what?
Just need to,
You gotta hit the power
Oh,
button.
we had to turn this on. Okay.
should pop right up.
There we go. Now I see what we can follow along now.
Okay, excellent.
Thank you.
It's important. That's important. Follow along. We have about 2.5 million cases worldwide. In the US, as of last night, it's probably closer to 800,000 today, but last night, 786,638. Total worldwide deaths are 170,000.
Mr. Chair, Lisa, would you define cases for us? Is it, where we test somebody and they have antibodies and we say, oh, you're infected, but they may not be sick. Are those counted as cases, or are these only people that have been hospitalized, or how do we count cases? So we
These
have
are
a-
confirmed cases, so they have been tested, and someone who is not sick would not get a test.
But what if they're tested and found they're not sick, but, because there are areas of the world where they're testing people. In fact, where did I read last night? They've tested almost everybody in one particular county in Southern California to find out what the infection rate is in what they call the herd. Do those people count as cases, even though they may not be sick?
I am not sure, and I don't. They are, okay.
They are? Okay, this is important for us to know in terms of definitions. It reminds me when the 35W bridge fell down and engineers started throwing out engineering terms to describe bridges, and the public was very confused about the difference between a fracture critical bridge and an obsolete bridge, for instance, functionally obsolete. And I'm finding this in this whole discussion, that there are terms being thrown around that may mean one thing to one group of professionals and quite another thing to somebody sitting at home drinking their coffee watching the 6 o'clock news. So, but thank you. I just
Okay.
want to be sure we're clear on what it is
Yep.
we're talking about.
Thank you for the question. It's important also, in Minnesota, they're only testing a very small number of people. Well, actually, it's about 40,000 now, but you have to be a healthcare provider or someone living in a congregate setting. They have been doing syndromic surveillance, so calling clinics and identifying who has been presumptive positive, so couldn't get a test. I could tell you my son got every single symptom, went to the doctor, they gave him a strep culture and said, well, it's not positive for strep, you probably have corona. He did not qualify for a test. And he's
Wow.
very, very sick puppy.
Yeah.
But they estimate, based on that syndromic surveillance, so they call around to the clinics and identify that, they think that about 1% to less than 1% of the people that are positive in Minnesota represents the actual number of people that have coronavirus right now.
Okay.
So we have about, I think it was 2,500 positive cases, so 2,500 people that tested positive, so multiply that. So you're looking at a lot more people in Minnesota.
So, Mr. Chair, so you're saying 250,000 people?
It's very possible, based on the syndromic surveillance that
that
they're
num-
doing right now. So these are people that are currently able to take care of themselves at home. If you're hospitalized, you get a test. I got a call at 1 o'clock in the morning, someone who was very, very sick, went to the hospital, they weren't sick enough to get hospitalized. So there's a lot of cases out there that aren't getting tested. And as we expand the ability to test people, we'll know a little bit closer. But right now, this is what we know based on confirmed cases. And if we look at, if all things are equal, and we look at the 5-day moving the curve, we talk about we want to flatten the curve. This is new cases with a 5-day rolling average with the top 10 most affected countries. So US is green. This is not the place you want to be number 1 at, but we're way, way ahead. So this just shows new cases per day, and if it's a flattened curve, they're on a downward trend. So we're not on a downward trend yet. We haven't reached the apex.
Now, Mr. Chair, Lisa, sorry to pepper you with questions, but again, to be precise in definition of terms, the reason the United States is the high green line there, could it be related to the fact that we've tested more people than any other country in the world by a long shot? Because these are only people that have been tested and confirmed, correct?
In the US, yes. I'd have to look up how they're counting them in the other
In the
countries that are represented
yes.
here,
Okay.
and I could get back to you on that.
That's an important number for us to know. We need some context here in what we're dealing with.
Right.
Because one of the complaints that I'm reading about in my feed, other countries complaining that the United States is sucking up all the testing materials and that we've tested more than the next 10 countries combined. So if you could define that for us, that would be helpful.
check.
It would give us some context with what we're looking at here.
I think the testing could be on the previous slide too. So total tests conducted in the US is on there, 4 million tests conducted in the US. I don't know if I click on Spain, no, I guess I can't do that. I can get back to you on that, but we can find out. But in Minnesota, we've tested about 40,000. I've got that on the next page.
Before,
Mr.
one
Chair,
question.
thank you. While we're on that testing discussion, and perhaps Dr. Wilcox will weigh in too, you know, the governor has been talking a lot the last couple days about we're going to do more testing with a goal of doing about 40,000 a week. You know, now that the U of M and Mayo are up in testing, that's the stated goal. That's almost as many as we've done so far. Yet you just talked about how very few people are tested. Do we see any evidence of that changing yet? How's that going to change? Because it seems like we have, we're not testing. We've only tested 48,000 in 6 weeks, and now we're going to do 40,000 a week. It's what's going on with that?
Yeah, come on up and,
Might be a joint 6-foot thing.
yeah. Might need 2 mics now.
Thank you, Commissioners, for the opportunity. You know, Commissioner Beard, I think one of the reasons we're seeing that really high uptick in our country is related to the fact that we're doing a lot of tests in hot zones right now. If you look at New York, for example, that's a hot zone. If you're looking at New Orleans, that's a hot zone. If you're looking at Miami, that's a hot zone. If you're looking at Boston now, that's becoming a hot zone. So when you end up admitting a large number of patients in these hot zones in a very short period of time, you get that uptick. And that's what we're seeing here, I think. Now, what we hope will happen is the rest of the country can learn from this so that we can flatten our curve in Minnesota, for example, so we won't hit that uptick that catches us off guard, like happened in New York. I think what happened in New York was we had a large number of folks coming from Europe entering our country in New York. It's a place where you have a lot of people coming in from overseas. And they were undiagnosed folks who had coronavirus from Western Europe and Italy and so on. I think that's what caused that uptick, and that's what we're seeing is that really high curve at this point. These are actual tested cases that we're seeing there, and these are tested cases that have been admitted to hospitals in those hot zone areas. When it comes to testing, the linchpin on all of this is we need tests. We need to have the opportunity to test early on in patients that we feel may have the illness. And we need to have tests available then after folks have gotten through this illness to determine what their immunity is so we can put them back to work. Now, I'm optimistic. We've got, you mentioned Mayo, we've got the U of M. They've got some great testing options available, and they suggest they're going to be giving them out to other people in our state. That's great. Love to see that. Part of the problem is, though, we've got labs that can test for these things, but we may not have reagents and materials to collect specimens to bring to the labs. That's been a problem.
Yes.
The chain of getting these materials in place to properly test has been a problem in our country. It's been kind of piecemeal on how we get this stuff done. I think if we had more of a national approach to getting these materials to get the tests done, that would be much more efficient. But we aren't going to really be able, I don't think, to open up our economy as vigorously as we would like to without having the ability to do lots of tests on lots of people who are asymptomatic or asymptomatic or both. If you look at what has happened in a positive way overseas, if you look at what they did in Korea, if you look at what they did in Germany, if you look at what they did in Denmark, they early on embarked on a vigorous testing program across the entire nation, symptomatic or not. And the only way you know how lethal this virus truly is to be able to test many, many people in a community, symptomatic or not. And then you find out what is the ratio of lethality to this virus versus people who are walking around asymptomatic or minimally symptomatic. And we don't know that till we get tests. And we really can't open up the economy in a proper scientific way unless we have tests available across the board to complete the process here. Okay?
Dr. Wilcox, I would like to ask you a question,
Sure,
probably which you can't answer, but I still want to ask it for your comment.
sure.
Would you, in your assessment, are we at the beginning, the middle, or nearing the end of this crisis? Where would you say we are? You know, early beginning, middle, somewhere towards the end? I get a sense that people have a false confidence that we're somewhere towards getting over this. What's your assessment?
That's a great question, Commissioner. You know, I think it's going to vary a lot depending upon how flattened that curve continues to be in our state over the next several weeks to months. We have been successful in our state, I believe, with the sheltering in concept where we've kept people kind of away from each other. We've had success in flattening that peak and dropping that surge thing down significantly in our state. As we continue to follow this approach, that curve will continue to flatten, and what's going to happen is the surge is going to move down the line, down the next several weeks to months. It looks right now, statistically, and maybe Lisa, you'll be talking about this here in a little bit with the stats, but it looks like our surge in this state originally was projected to occur the end of this month. It's now, I believe, moved to the middle part of May. If the flattening continues, we may actually not see a surge in our state till June or maybe first part of July, is what they're saying. So if you look at that, the recovery in our state is going to be more gradual over the next several months. I really don't see that, this end of what we consider to be a normal getting back to lifestyles is going to happen by the end of this year and probably into the first part of next year. There's going to be an impact that we're going to have to deal with. We're going to have to deal with a new norm here. We aren't going to get back to the old way of doing business and doing things. We're going to have to gradually get back into that area, following science, getting testing appropriately in place so we can do appropriate follow-up and opening up of our economy based upon those statistics. That's what we're going to have to do. That's a good question. Okay.
Thank you.
That's not the answer I think we were looking for.
Sorry. So looking at Minnesota and also Scott County, since Friday, Minnesota has jumped in numbers to an additional 300 cases statewide. And I checked to see, is it a result of more testing? And it wasn't. I was checking the numbers, and we didn't do the most testing that we have done in the past. So we are currently at about 2,500 cases with 143 deaths. Locally, we also jumped. We were pretty flat for a while, around 20 cases. Since Thursday and Friday, we've had an additional 7 cases. And on Saturday, an additional 3 cases, and 2 of which were hospitalized. So we previously haven't had very many people needing hospitalization, but that jumped up as well. So as you see, we still only have, thankfully, only 1 death, and the average number of days of illness is extending a little bit, but the good news is 19 people have recovered. They're out of isolation, and several are on their way to recovery.
Lisa, question, I know that, I don't even know if you've had the information or we have the information, but is there, I'm gonna use a term, I don't know if I wanna use the term hotspot. With these numbers that are jumping in our county, is there, are numbers in proximity, family units, whatever, or is it just popcorn here, 1, 2, over?
Yeah, there was only, out of the 27, only 2 were familial. I did check that the other day, that shared an address. The good news is I'm sorry.
I was just gonna,
Commissioner Wolf?
and you're saying they're all over the county?
All over the county. The good news is we don't have any current outbreaks in any of our long-term care facilities. That would be a huge problem. That's why you see St. Louis County is very blue there. They have one of the largest outbreaks of coronavirus in the U.S. in a long-term care facility. So we're seeing a lot of mortality there. Did you break this, Dr. Wilcox?
Uh-huh, yep.
There we go. I just want to talk a little bit about the strategic plan to remind people that we adopted a strategic plan in December of 2019. That seems like a really long time ago, but it wasn't that long ago. And the board, I don't know if this was foreshadowing, but I'm very thankful we adopted that will foster public preparedness and respond when families and communities face health and safety emergencies. Looking back then, looking forward, I don't think we would have anticipated we would be here now at this point, but we have some things in place. Our strategy was to enhance the safety of residents by ensuring efforts that prepare residents and communities for emergencies, hoping that our communities would be more prepared. And the tactic that was in there was develop and implement a plan to engage the community in emergency preparedness and develop self-reliance. I want to talk a little bit about some of the things that are going on with self-reliance, particularly about food and some really shining examples in the community. The YMCA, one program I want to highlight, recently started a program of Heat and Eat meals. You can see the meal there. It's a pre-cooked, healthy dinner. They're also doing bag lunches that are available. The meals are cold and they just have to be heated up. This is in partnership with Loaves and Fishes, United Health Group, who are cooking the meals, Nutrax, who are transporting the meals, and they're actually currently looking for some new food partners. They're actually doing these meals Monday to Friday from 12 to 2. Originally they were having individuals come inside, and after consulting with me, we've created a drive up, so people are coming up, getting much less exposure for the people and as well as the staff, and they're bringing them to their cars. And this past April 17th, they distributed 400 meals. They ran out of food in 15 minutes. They pre-ordered the meals the night before. She said 400, they were gone like that. So they are going to hopefully expand that. They had approximately 1,600 to 2,400 those meals would feed, because they feed about a family of 4 to 6 individuals. So that's wonderful. They also, as you know, we're setting up an isolation and quarantine site, and they have agreed that if we do have people in our isolation and quarantine site, they will deliver meals at no cost to the county to that site, which is a wonderful partnership.
Mr. Chair, Lisa, you said that in 15 minutes sold out the 400 meals. Any qualifications? Is it open to anybody?
This is open to anybody.
And no geographic qualifications either?
Correct. I do have some geographic information on the next slide.
Right.
And they actually just started this program about 3 weeks ago, and since then, they've served 4,200, or almost 4,300 individuals and 1,000 families. The Esperanza Food Drive continues to distribute food and grow. Last Friday, or Saturday, they served 375 families, which was 1,875 individuals. Predominantly, those folks were from Shakopee, 60 to 70%, followed by Savage, Jordan, and Chaska, and a few smattering from Burnsville. They weren't asking county, so they could have been Scott County, Burnsville, or not. They are now also partnering with the Y to include some of those ready-to-eat meals. And they are also delivering food to those that are homebound and in need of food. The cost from last Saturday was just over $1,000. This was funded by Public Health's grant, the MEDA grant, Mobilizing Equity Data to Action. And they also agreed to assist if we have people in the community in isolation quarantine and also at our isolation and quarantine site. They did send me a few stories, and I just wanted to share one here. This was from a resident. We have no food left. I made my kids butter and cheese sandwiches for lunch today, and that was the last of it. I haven't found any help so far and didn't realize my unemployment would be taking so long. And I have no gas to even get to the food shelf. I am by the prison and willing to walk anywhere. I need to get food even just for my kids. And this person is now receiving the home delivery food from Esperanza, so she is taken care of. There are many other food distribution programs in our county. We are monitoring those and getting some information to see what the surge is and when they might need some assistance. Here's just a few of them. Friendship Church in Prior Lake, they serve 275 to 300 families. They haven't seen an increase, but they're still serving those 300 families. So there are still people in need beyond the corona need. Peace Center hasn't had major increases, but they're still serving 131 families and distributed almost 12,000 pounds of food. Belle Plaine Food Shelf as well, no major increases, but numbers are about the same as last year, which is still a big number of 15,000 pounds. Jordan Area Food Shelf, they also are serving about the normal amount of people. They've changed their the way that they're doing it. Hope for Community Church in Elko New Market has once a month. Heart Ministries is now doing a food drive. The CAP agency has also continued. All of these programs have been reporting that they are seeing an increase in donations, which is really nice to see. Going back to our strategy, we thought that we would need to work with the community to help them develop and implement a plan to get them engaged. And it's just been very, very hopeful to see that they've stepped up without us asking. We have been coordinating with them, communicating with them, making some partnerships, but really overall they are pulling together. A lot of different agencies are pulling together to help each other and help those in need. So it's really stories like this and these programs that give me a lot of hope. And I've just been so impressed with the strength in our community. So if you don't have any questions for me on that, I'm going to turn it over to Teresa, who will talk a little bit about more detailed data.
Yeah.
Lisa, thank you, Mr. Chair, for recognizing the strength of the spirit of the community. I remember a couple of years ago when I was asked to give a State of the County address, that was one of the things that we wanted to stress as a board was that the strength of our county isn't in how excellent its government is. It has excellent government because we got good people in the county. And this crisis is kind of giving a shining example of what the people in the community rise up and do on their own. And our goal is basically just to make sure that stoplights work and the toilets still flush and the right things get done in the right time. So thank you for recognizing the strength of the spirit of the community.
Thank you, Commissioner Beard.
I've been told I'm supposed to speak more into the mic, so I hope they
Oh,
got
sorry. I heard you. I don't know if
Okay, good
anybody
enough.
else did.
It
but-
was intended for you, thanks.
Thank you very much. It's just really nice to see and people helping people versus relying on the county services. So it's very refreshing.
Beautiful
But there's
picture.
a thousand other examples that nobody knows about, of
Yep.
neighbors helping neighbors and families taking care of families, and good stuff. Thanks.
Thank you.
Another question for you.
Oh, sorry, Commissioner.
Yeah, thank you, Mr. Chair. I totally agree with your comments, Commissioner Beard. Lisa, this might not be for now, it might be kind of for a kind of ending up or closing up this section, and I think the other presenters might want to weigh in too. But actually right before this meeting, I just got off a Zoom meeting that Senator Pratt and Representative Tabke were on, and some other community citizens, in the talk about opening up the economy and how that's going to happen and the steps. And you know, there's a lot of debate on that. And we've all been hearing from folks who think it should be done faster and some slower and this way and that way. But some of the questions and things that have been brought up is to allow more local control, and that counties might be well served as they have public health departments to be helping in that way. Some of my comments to this group so far, at least for us in Scott County, because we do run lean. We run a lean machine here. We don't have a ton of capacity. Our people are working. We have lots going on, and we got the regular work of, like I said last meeting, when that state line opened up, it helped 911 dispatch, because we need to do the regular work too. So think about and maybe comment on what the capacity would be of the public health department, and law enforcement also would have to be involved if more of the monitoring of what happens out in the community by businesses and in the economy fell onto our shoulders. And of course, that would require some legislative changes and things, but I know some of that's being considered, and I think we need to weigh in on that. In my comments today, I said I'm all for local control. Well, I kind of think we should just self-police and you know, do good, but when local control is possible, I like that. But I really question that capacity right now. It's not like we can stop having staff do the daily check-ins with the people exposed to tuberculosis or the other things like that, or how much of our public health department really is grant funded where we don't have that capacity to do other things. So if you want to think about that a little bit, and I'm sure there'll be several comments, because as Dr. Wilcox said, I think we're going to be dealing with this for the next year. There will be businesses will be open, and what will our role be in either helping and educating and helping them open in a safe way and keep our citizens safe, or if we get asked or told to do more than that, having to do with monitoring and enforcement. So just something to think about and perhaps comment on at the end.
I can wait till the end.
Thank you.
I've got a question for Dr. Wilcox, if he's there still.
Is?
Hey, Dr. Wilcox, I'm aware, obviously, all of us are, that there are hotspots around the country, you know, different cities, you know, densely populated cities, but Ground Zero has been also defined as long-term care facilities, and I'm aware of, in our state, that many long-term care facilities don't have the personal protective equipment that they need. They're wearing cloth masks that have been made, or a step above that, I don't know if it's above, but alongside that would be the white masks that neither one is really said to give protection against the virus. And these long-term care facilities are only their few weeks worth of N95 masks when they have an outbreak. So I guess I'm wondering, what's your sense of the state of personal protective equipment in Scott County and within our care facilities and hospitals and so forth?
Yeah, that's, again, Commissioner, great question. You know, as you review the folks who need PPE, we're talking about law enforcement, first responders. We're looking at individuals who are on the front lines in hospitals, in clinics, and in our skilled care units who need this. As it stands right now, in several different sectors where I'm doing medical oversight, right now, I am told we have adequate supplies of this right now. Now, the problem is, though, if and when this surge hits, we're going to need more, and we're going to have this in reserve to bring up to the front lines as needed. In skilled care settings, unfortunately, we are in need of this kind of PPE now. And I agree with you that we do not have, in some of our skilled care units, enough of this to properly protect the workers within our facilities there and the patients that are presently within those facilities. Now, what we're striving to do is be very conservative on the PPE we have available across the board. And we're doing some innovative things to perhaps protect the integrity of PPE so we can utilize it on a recurring basis as long as it's not soiled and as long as the integrity is in place. And we're finding innovative ways to utilize this PPE in that setting. You brought up, Commissioner, the cloth masks. To be sure, they do not protect us from getting the virus. What those masks may do, however, when you wear them, they prevent that person who may be not symptomatic or be minimally symptomatic of the virus, and they aren't aware of it. They're protecting us from them. That's what those things are used for. We sometimes also have been utilizing those masks to protect our N95s. So if you have a patient who has confirmed COVID-19, you need to wear an N95 mask in working with them. There's no question about that. And you can preserve the integrity of that mask to a greater degree and reuse it if you place another mask in front of it, like a cloth mask, to keep that N95 functioning properly, as an example. Always can need more PPE. You can never have enough PPE in my mind's eye. even if at the moment you think you've got adequate supplies, you never know when this surge is going to demand a more brisk usage of this kind of material, this kind of equipment, and you need to have that in reserve. There's no doubt about it. Did I answer your question, Commissioner?
Yeah, thank you.
Sure.
Mr. Chair, Dr. Wilcox.
Yes.
Michael Morris from St. Francis on the call earlier today said that they actually are running lower than they thought they would be on PPE because they had so much stockpile that expired. And he explained, you know, it's not how does a mask expire? Well, the elastic got old and brittle and things are breaking. And so that some of our stockpiles were not sufficient because they're expired. So that was the indication this morning. Not that they're crisis shortage, but it's not to the extent that a lot of people thought because of the stockpiles weren't all usable.
Yeah. You know, that's a valid point. When you look at, in particular, the N95 masks, the respirators, if they're going to work properly, you got to have a snug fit. It's got to cover the nose. It's got to incorporate the jaw. It's got to be tight. You can't have any leakage around it. And if you don't have the elastic in place to keep it properly in place, that can be a problem. There's no question about that. Again, what I've been telling my folks, my EMS people in particular, if indeed you have perhaps an expired N95 mask, the integrity of it still can be determined by putting it over that face, making sure it's tight fit and there's no leakage around it, and then keeping it from getting soiled.
I was just gonna, Mr. Chair, so you said testing was the big key?
Yeah.
The vaccine, isn't that the real, and how far away do you think that is?
That's the holy grail of this thing. There's no question about it. The vaccine is going to be months away. They may have some preliminary vaccines available by the fall or beginning of this next winter to administer to healthcare workers. They would be the first ones to get this. And then when you talk about the population, they're looking at a year or year and a half down the line to have proper vaccine available for this type of virus. They need to go through a very vigorous pilot program to make sure that the vaccine is safe to use and that it's doing what is expected of it to provide immunity for patients who are getting it. Another area I think that we're looking at vigorously through several pilot programs would be antiviral agents and so on that might be useful in the short term. We have many of our higher learning institutions doing pilot programs, the U of M, Mayo, in experimenting with some of these antivirals. Remdesivir is the one that you may have been hearing about most recently. It's an antiviral agent you administer intravenously. Some preliminary studies have indicated that this has been a good drug to go with early on in our critically ill patients who have this illness. Hearing a lot in the press about Plaquenil, hydrochloroquine, and so on. Still unclear where that fits in this whole picture. What has been out there is anecdotal. There's been no sound scientific evidence that would indicate that this is a drug that is useful to use in this viral pandemic. And unfortunately, it does have side effects that can impact heart function, especially in individuals who have previous cardiac issues. And some of our most vulnerable patients are elderly who have heart conditions that can really become very ill from this virus. So if you prescribe that medication to them and they already have a heart-related issue, that can be a problem for them, as an example. So
In
we
that
have a
one,
number of...
What
go ahead.
specific, what medication is that the?
Hydrochloroquine.
Yeah, okay.
Yeah, it's an anti-malarial
Yeah,
drug. It's been
right.
around a long time, relatively inexpensive, but it has side effects. It prolongs the QT interval, it causes cardiac rhythm problems. And something else we're finding, we used to think that this virus primarily hit the pulmonary area. But now we're finding, well, yeah, for most people that's what gets hit. But some people it hits the heart. They end up with cardiomyopathy from this. Hits the kidneys. They end up with renal failure with this. Can affect the liver. You can end up with liver failure issues with some of these people. And it hits the GI tract. you can end up with recurring GI symptoms with some of these folks as well. So it's a novel, unique virus that's hitting many organ systems, primarily the pulmonary area as we understand it now.
Thank you.
Good morning.
Good morning, Mr. Chairman, members of the board. I'll be diving into some more statistics related to the state of Minnesota. So first, we have here this map of Minnesota. You've seen similar ones probably from the Minnesota Department of Health and on the daily situation report. So this again is just showing the number of cases by county. That darker blue there is, those represent counties with the highest number of cases. So kind of as we would expect, the metro with the highest population has the highest numbers of cases, that big dark blue spot in the middle. You can of course see other darker blue areas spread throughout the state. But it's kind of hard to compare county by county when we look at this because we know there are large population differences between the counties. So looking at this purple map on the left, this is evening out those differences between counties. So this is looking at the cases per 10,000 residents. So again, the darkest purple is the highest number of cases per 10,000 residents. So we can see the metro is a lot lighter in this purple map, so fewer number of cases per 10,000 residents. But we can see darker areas in the rest of the state that aren't necessarily as dark in the green and blue map on the right. For example, Nobles County, down in the bottom left-hand corner, has 34.5 cases per 10,000. And Martin County, again, in the southern part of the state, has almost 21 cases per 10,000 people. So this, again, just evens out those differences, lets us compare between counties and identify possible kind of unexpected outbreaks or unexpected higher numbers than we would think we would see given population size. So again, thinking about those cases per 10,000, even within the metro, we have differences in population size across the counties. So here we can see how cases have increased in the metro region by the number of cases per 10,000 residents. So Scott County is that dashed black line at the bottom. We can see increases in the number of cases per 10,000 residents for pretty much all of the metro counties, with, of course, Scott County being the second lowest there. Carver County at the very bottom has stayed pretty stable, keeping about the same number of cases per 10,000 residents since March 23rd. And this is that same chart, but with, this shows the 10 counties in Minnesota that have had the largest per capita increase since March 23rd. So they are listed there at the top of the screen, but we see these are all rural counties. Scott County is on there for comparison, but these 10 greater Minnesota counties do have had the fastest and largest increase per capita since March 23rd.
Mr. Chair, them looking at the, particularly the Nobles County deal, it looks like an outlier to me. Is there something unusual going on there? And I know there's a packing plant where they had a lot of people working in close proximity, but is it the kind of people that are working there, like age-wise or travel a lot, itinerant, anything they can identify that would say, we have this here, but we don't have it at 3M or Gerardo Steel, for instance, or even at Rahr Malt? What's the deal?
I don't know
Any
the
ideas
specifics
yet,
of
or?
the cases in Nobles County. I do know it's tied to the meat packing, and that is a lot of close proximity. I don't know, at 3M and things like that. From what I have heard, they're not as close proximity as people at meat packing plants. I know in South Dakota they have
Maybe a better choice would be Wilmer, Genio. Pack a lot of turkeys and lots going on there. Then I think there's a couple other chicken packing plants. Austin, down in Mower County, we don't see them showing up on this. You don't have to answer it now, but just know that we see something like this and we think, outlier, what happened, what can we learn from this instance that help prevent some things happening somewhere else?
I can address that at some point.
Okay, that's fine, thanks.
Okay, so then this year is actually measuring social distancing, showing social distancing since about March 8th. So this data actually comes from anonymized cell phone data, tracking people's locations through their cell phones. So we have seen that straight line across the top at 0%, that shows average travel. Before this pandemic, what were we traveling on average? So we see large decreases, a lot of dipping below zero in distance traveled for both Scott County and Minnesota. And those are pretty much mimicking each other. There's not huge differences between Scott County and Minnesota. We can see here on March 16th, that's when the White House released their social distancing guidelines. We see a big drop right after that. On March 17th, that was in Minnesota when bars and restaurants were closed and Scott County buildings closed. Again, still seeing drops. And on March 18th was closure of salons and barbershops and when the school closure was in effect. So we can kind of see how that impacted the distance people were traveling. And then on March 27th, that was the day that Governor Walz's stay-at-home order went into effect. So we see large decreases. After that, it's kind of up and down a little bit, but still overall much lower than our baseline of 0% there. So this also is showing social distancing, just comparing now Minnesota to the state of New York and the state of Michigan. Those two states, because they have some of the highest numbers of cases. And again, Minnesota is kind of the same as Michigan and New York in this. There's not huge differences. But where there is a difference is these two triangles here at the top for Michigan and New York represent the time when those two states had their first 50 cases. So at 50 cases, they were still traveling pretty close to what they usually were. They're pretty close to that zero baseline marker there. But then when we look at when Minnesota got 50 cases, we were already, our travel was decreased already by about 20%. So that's kind of a good news, good starting point, showing that we were already at 50 cases, being more socially distant than states like New York and Michigan who have a very high case count right now. And same thing with the 100 case count marker. When New York and Michigan had 100 cases, they were still traveling a lot. They weren't being very socially distant. Again, in Minnesota, we're about 30% less travel at the time we had 100 cases. Okay, now this chart here is showing doubling time, so how fast are cases doubling. All of the dashed lines on the screen represent where cases would be in Minnesota if we had doubled at the rates that the colors of the lines designate. So that red line there, if cases in Minnesota had been doubling every 2 days, we'd have a very high case count kind of off the chart there. You can see the blue line for Minnesota, that is where we actually are and what's actually been happening. So at the very beginning, beginning of March, about March 6th to March 18th, the slope of the blue Minnesota line very closely matches the slope of the red dashed line, meaning at that time we were doubling about every 2 days. We're very close in alignment with that red dashed line. Soon after that, we can see it start to flatten out a little bit. So from March 24th to March 30th, the slope of the blue Minnesota line matched pretty closely with the slope of the line for doubling every 4 days. So we'd went from doubling every 2 days in the beginning to middle of March to doubling every 4 days towards the end of March. And we're still seeing that flatten out even more from April 3rd to April 12th. We've flattened out to be doubling about every week. And even since then, it's kind of spread out a little bit more, so it's even extended beyond a week now of how fast we're doubling.
If I could make a comment on these charts and stuff.
Yep.
To me, it's really false information in that we're only testing a very limited population. So this is really giving us completely false read based on not enough information. Do you have a comment on that?
Back to my original question. Thank you, John.
Yeah, so kind of the grain of salt with all of these is it is only based on those positive test results. There's not much we can do beyond that right now until there's more antibody tests in place or things like that. So I guess the benefit of these is we can compare them to other states and compare across counties and know that we have that common baseline. Everyone across the board is just using the results of positive tests. So that's how we can compare between. Again, keeping in mind that it is likely much larger than this.
Thank you.
Okay, now this slide here is actually from Governor Walz and the modeling that the University of Minnesota did. This shows kind of what I was talking about of comparing to states like New York and Michigan. So on the very left of the graph, that is every state when they had 100 cases. So we're setting a common baseline of states with 100 cases. And then the lines going across the screen are what has happened since those 100 cases. And a lot of Minnesota is very near the bottom. So after 100 cases, we've had fewer cases since then than all those other states above Minnesota. So again, that's a good thing, and that kind of ties back to we're seeing better social distancing in Minnesota, things like that. And again, from Governor Walz here, and this ties into also what Dr. Wilcox was saying about pushing out that curve. The more we're social distancing, the more we're staying at home, the more we push out that curve, the more we push out the surge. So the row in bold, that is currently what Governor Walz has gone with extending the stay-at-home order for 4 weeks until May 4th. And you can see by that bolded row there that by doing so, they project through the model that the surge will happen in mid-July. One reason, as shown on this chart, for doing that is because it's decreasing the demand on the ICU and decreasing overall mortality. The more you push that out, those numbers decrease. Okay, so that is the last of my charts, so I'm happy to take questions if you have them.
Thank you. Any questions on the data, as it were?
Thank you.
Thank you very much.
Maybe related to that, 2,200 ICU beds in the state, is that what we think our inventory is? And what is Scott County? Is it 64? I've heard that number.
The numbers that we have here are those that are designated in the state right now.
2,200.
22,000 or 2,200.
Okay.
And Scott County, that would probably be what we're looking at St. Francis, I would think.
And Queen of Peace.
Queen of Peace could open up some additional beds if necessary, if there was a surge.
Okay,
Correct.
that's helpful.
Would you say that, you mentioned the surge and kind of just how we started with keeping data in context, which is sometimes hard to do, but the surge you kind of talked about a couple different times, are we basing that on the data that we have, which is primarily New York and some of these other hotspots? Is that kind of what we're using as our baseline because that's the information that we currently have?
We're basing our surge data on information that's coming from the epidemiologists that are nationally recognized in each state. That's what we're using. So we rely on our epidemiologists with their expertise to decide this for us. A lot of it's based upon, though, what data was presented here. The curve is flattening out, and when that curve flattens out, that means the surge also moves down the line. Mention that. So originally, the surge was thought to occur here a month ago, end of this month. Then it moved down into the first part of May, and it looks like if we continue to follow what's recommended here, our surge is going to end up then in July. But, you know, the thought is that doesn't mean that our economy won't be opening up. It will be opening up, you know, based upon science, testing, and principles of that type. And it's going to be, the beauty of that also is then, is this, the number of really sick people who need to be in ICUs and on ventilators won't overwhelm our healthcare people. You know, that's the really, really big thing. So my hope is we won't ever need to use all of those ICU beds or all of the ventilators and so on that we have available right now. That would be my hope. But, you know, in order to then move ahead in a positive way with a focus on the economy and how we can, in a scientific way, open up various areas in the economy to get people back to work, that's going to be based on testing. That's going to be based on having many tests available to test not only the ill, but also those that are walking around in our communities. We need that. And then also, we need to have additional testing that tells us if someone has antibodies against the virus, they should be able to go back and do their work, go back into the communities and open up work opportunities for them. And that's going to demand, again, testing on a very large scale. Now, Commissioner Brecky brought up a very good point. Now, who's going to do the testing? You know, I mean, most often that's public health that, you know, is going to be asked to do that. And we're going to have to add some resources, I think, to our public health providers in order to get this testing done. I think we're going to have to look outside of the box. You know, I've been a champion of having EMS help out with this. I mean, you know, in the past, they've been public safety people, but they're out in our communities. Why not have them do some work in healthcare and going into homes and communities and doing some of these tests? We should be able to do that. Same with community health workers. There's no reason at all why we can't ask them, especially in their unique cultures, to help us get this testing done. You know, we're going to have to think about that. We're going to have to train individuals to do these tests, and then also point of contact testing. That's what we're going to have to do. If we've got someone that's got a positive result for COVID-19, we're going to have to investigate who around them has been exposed to this virus, and we're going to have to pursue those people and keep them quarantined until we get a handle on what's happening with them. We do that right now with tuberculosis. We do that with STDs. You know, this is kind of an expansion of that on a bigger scale. We're going to have to do that. Last thing, and I don't want to take up a lot of additional time with you folks, but Commissioner, you asked about what happened down in Nobles County. That was a meatpacking plant that got hit real hard. And guess where those workers were working also relative to what they were doing in Nobles County? Where do you think? Sioux Falls.
Sioux Falls also.
Okay, it speaks to the issue that this virus doesn't have boundaries.
Sure.
You know what I'm saying? And South Dakota did not have that sheltering in thing going on.
I want to ask about that because let's just assume for a moment that the packing plant was, you wouldn't have to assume that, packing plant was listed as an essential business.
Yeah.
Had there been a shutdown order, what would have changed?
Well, you know,
Probably nothing. It happened, and what we need to know is where did it come from and how did it spread so quickly?
I think, like you said, you learn from this.
Yeah,
okay?
please.
If you look at the environment within these meat packing plants, you cannot keep social distancing
Correct,
there.
yeah,
You got
it's pretty
people on top of each other in a production line to get you know, the meat produced in a very efficient and timely manner. And it's interesting, the workers that were working in Worthington were bused to Sioux Falls to do similar work in that meatpacking plant. See what I'm saying? And then a lot of times these folks also are of a different culture. They have large number of family members living under one roof.
Sure.
And you end up then contending with spread of that virus then as a result of that within households and so on. And it speaks to the issue of congregate spread of this virus.
Yeah.
If you look at where it really hits hard, it's in congregate settings. So you're talking about skilled care units, factories that are really you know, intense in their working environment, kind of on top of each other. And you know, we're going to have to learn from this. If we're going to have industry that is dealing with this virus in a way that's efficient, they're probably going to have to do testing internally of their people before they come to work to see if they're sick, and if they are, they got to go home. If they aren't, go ahead, you know, bring them in and have them work. And then along with that, if we do have some viral issues, proper PPE, the industry is going to have to provide that for them, is the thing.
Mr. Chair, and I actually saw that yesterday at a Walmart in Shakopee. I wandered into the garden center and they had a girl stand and she's taking temperature. The employees all had to go by and take a temperature, and if they thought they had a temperature, they had 10 or 12 days that the government paid for, somebody paid for. And we don't want you here if you are sick. And I thought, well, that's a great way to maybe open up some of these other little, I mean, I'm just seeing so many little mom and pop people that are calling me or emailing saying, we got to open up. One woman I know has a clothing shop. She got her whole shipment of stuff she's paid for, and it's all sitting in a little shop, and she only gets 2 or 3 customers at a time at the most anyhow. So it's like,
no, I hear, you know, and I hear, you know, I hear those issues, no question about it. We got to open up the economy, no question about that. But we have to follow the science in allowing that opening up to occur in a manner that's going to prevent illness from spreading. And, you know, I think it's a matter of getting tests. We got to have tests available to do community testing. We got to have a large number of them. We've got to have the manpower available to get them done. We've got to have an efficient way of turnaround. What are those results telling us? You can't wait 4 to 5 days to get those results back. You got to have them back within hours, within a very, very short period of time. As I've said, I think we're pretty fortunate in our state. We've got some really good institutions that are mass producing some of these testing materials, Mayo, U of M. But my concern is, do we have enough reagents in order to get the testing materials in place to bring to the labs for analysis? Got to work on that.
Mr. Chairman, Doctor, thank you. Again, definition of terms, the
Yeah.
average person home thinks reagent, what's that?
Sure.
So I know that we need to be clear about that too.
Sure.
I think there's an amazing opportunity here
Yeah.
with what happened in Sioux Falls and now in the Worthington plant. Why not in the Austin plant? Why not in Wilmer? For somebody to actually, I mean, here we've got another microcosm like we did with that cruise ship where we had 4,000 people.
Yeah.
And only about 20% of them were infected. Great question. We can test everybody in a small concentrated area like that, and we can learn from that. Why? Why were some not infected? Why were some infected? And why were some infected but didn't get sick, didn't show any symptoms? You know, there's all kinds of things we can learn, and it's right there. It's close, it's compact, and I think that, I hope that the university and the Mayo can really, I'd hate to say take advantage of a bad situation, but use the situation in this unusual time to help us expand our understanding. As you say, the science is right there for the taking.
Absolutely. Follow the science and the rest will shake out if you open the economy in a measured manner based upon research and proper utilization of that research.
Yeah.
Follow the science.
Well, some of us are really concerned about that, about the economy. I mean, some of us that have actually scraped and scrimped and to build our own businesses, I'm past that now. But when I look at the people who are making the decisions about the shutdown and the economy, I don't think one of us are losing a paycheck. Not a one of us.
Yeah.
But I look at the people who are bearing the brunt.
Yeah.
I mean, these people can't make their tax payments. They can't make the mortgage payments. They've got inventory bought and paid for just sitting there on the shelves.
Sure.
It's just destroying them.
Yeah.
And I got to tell you, my heart goes out to them. So
Absolutely.
Yeah,
There's no
just-
question about that. You know, we need to get our economy up and rolling again, but we need to do it in a measured manner based on the science with appropriate testing and working around the testing to open up various pieces of our economy.
sure.
That's what we got to do.
Dr. Wilcox, one question on opening the economy.
Sure.
I'm reading that hospitals and so forth are laying or furloughing people off, nurses, doctors, whatever, because the focus has been on the virus, and so they're not doing other types of treatments. It would seem to me that why can't you test somebody that say needs a knee surgery and they're tested, so then come on in, we'll do that surgery. Why can't we have sort of a way that we treat other people and not have to lay off or furlough doctors and nurses?
No, that's another great point, Commissioner, and I agree with you. I think some of our healthcare organizations are opening up the door now for some elective surgical procedures in a limited way. And I'm sure they're going through this testing regimen to make sure they got proper candidates and so on that they can do this for. I do find it interesting that in this time of healthcare crisis, the industry of healthcare is also suffering.
Yeah.
You know what I'm saying? I mean, what a dichotomy that is. And I find it interesting, you know, I'm thinking, well, you know, primary care providers should be able to continue to work to take care of these folks. Some of those people are being furloughed, you know, and ED, I've talked to ED folks that I work with up in the metro area, their ED volumes are down 40%. You know, so some of their docs, right in the front lines here, are being furloughed as well. And it's because patients are afraid to go in even if they have a heart attack or a stroke. They don't want to get sick from the COVID-19 virus. So they're staying home, unfortunately, not going in for care that's appropriate for their illness, for their emergency. And they're going to suffer long-term issues with that as well. And our ED numbers then are down. Very interesting dichotomy.
The problem worse than the cure or something like
Yeah.
that, right?
Right, very good. All right, any other questions for me?
Yeah, I just think when we're talking about the economy, I mean, it's not always just about the money either. I mean, the writing of old says, work is a gift from God. So not being able to exercise that work, there's a mental, physical, spiritual harm that comes from that as well, not just the bank account. So it's much bigger than just the dollar. But yeah, that's obviously a big piece of it. So yeah, I mean, I would just say we're in the vice. I mean, you've heard from all of us that, yeah, we have this thing and we're learning day by day, moment by moment, but we also, I'd be really interested to see this cell phone data the next 2 weeks, because it looked like the motion was starting to kind of trend back. Like, you don't bottle people up for so long. We need to get back to work. We, as we heard, I'm looking to my right, and hopefully our video's working, but with the call that you had, that we as a county can't come and say, all right, let's go back to work. That takes some action from St. Paul. We definitely feel the heat of trying to get people back to work and want to do that in a measured way, and because otherwise we're going to be televising self haircuts here pretty soon. And my high school hockey picture called wants its hair back. So we're working on that, trying to do what we can, but we don't have the control over that. But the one thing I would ask that was kind of kicked off down to my left is, as we articulate this data and some of this information at the county level, that we would be mindful, and I think we've been doing a pretty good job of it, is to give as much context as possible with the data, common language. When we're dealing with terms that we're familiar with in our professional work, I get that, we get that, but again, who was it? Was it someone with the coffee cup on the couch? They might not understand what some of those terms, or think, case, well, what is a case? Just whatever detail and depth we can do to help people understand the full measure of the data that we're trying to put out there would be much appreciated. And I think we've been doing a good job at that, but let's just keep that heartbeat.
Thanks.
Anything else?
Commissioner Beard, I just have just some final thoughts, and some of it might address Commissioner Weppen-Brecke's question. Some of the things we're hearing in the community do echo what Dr. Wilcox had mentioned about people being afraid to go to the hospital. We
Right.
are hearing from pregnant moms that
boy.
they would like some information about home births,
Yeah.
because they're afraid to have their babies in the hospital, and that's a whole, a high risk. We are already, without coronavirus, surging for some of those activities that are coming up. We already are seeing an increase. So for example, normally we have a smattering of high-risk home visiting clients. In the past 2 weeks, we've had 15 referrals. A lot more than we normally see. Many are related to substance use, child protection. So we are already surging with that. We're hearing from the Minnesota Department of Health that they are reaching their capacity for the case contact investigation and case tracing, and that's going to soon be turfed over to local public health. The good news is we do this every day. We do TB contact tracing every day for many other things, pertussis and lots of other diseases. So we can incorporate that into our day-to-day activities. We have caseload calculators that we're currently adding in coronavirus to see how long that's going to take, what's the manpower that we need. So until we reach our capacity, we're good. We have lots of trained nurses. We could also cross-train some of the Scott County nurses. We can use our volunteers. We have quite a few that used to be our Medical Reserve Corps that we have now retired nurses. We could use EMS. So we're looking at some of those things right now. We know eventually, maybe a year out, we're going to have to start doing vaccinations. And what does that mean? Do we still need to do social distancing while we're doing vaccinations? Because that completely changes our plan. We're thinking everybody's going to come in and we're going to mass vaccinate everybody like we did on H1N1. We might not be able to do that at this point, or somehow try and figure out, can we do drive-through? So we're going to be working on those plans as well, case contact investigation, continuing our surveillance. So we kind of already are surging, but if we need more help, we'll cross that bridge when we get there.
Yeah, I would just say also, if there's something, and Leslie's been very good, the information that comes to her to get to us. If there's anything that the five of us need to know, I'm looking over to my left, the good doctor and anyone in public health, I would say that on a daily basis, one of the five of us is talking with our St. Paul group or our DC group, our legislators, please let us know what specifics we need to be talking with them about. Because for the most part, they've been Tony, Eric, Brad have been very responsive. Angie Craig's office has been very responsive. Senator Klobuchar's has been pretty responsive. Tina Smith, not so much. And by that I mean zero, exactly. But with that in mind, if there's something specific that we can be helping to push that along, like I said, on a daily basis, someone's probably talking with one or more of those folks. So as much detailed information we can have to help push this, that's what we're here to do. So please let us know if there is something.
Well, thank you very much for your time this morning, and stay well.
Thank you, you too.
Thanks.
Thank you.
All right. Looking out, since we are social distancing here, I didn't mention that on the outset, but we've got people on the outside, very few people in the room, so we're making a little bit of change in bodies to keep with our under 10. But we are going to move to 7.1, looking to adopt resolution number 2020-075, approving an amendment to the 2020-029 Transportation Improvement Program to add County Project 21-36 to install a traffic signal system at the County Highway 21 and County Highway 91 intersection. And Mr. Winnicke, is it Anthony or, Anthony, it was written up as Anthony in the last go-around. Is it Anthony now, can we go with Tony?
Tony's just fine.
All right. Take it away, Tony. Good to see you.
Good morning, Mr. Chair, members of the board. Again, Tony Winnicke, Scott County Highway Engineer. So yes, we are seeking approval today to amend our Transportation Improvement Program to move money from our traffic signal spot safety program into an actual project, this county project 21-36 for the installation of the signal system. We have performed a very detailed traffic operations and safety analysis at this intersection, along with a consultant that we brought on board for that. There's been lots of interest at this intersection. Okay, so we've heard from people. It's been on our radar for some time as well, just to kind of watch and monitor it and make sure everything's still going okay. And you've got some residents in this area, some older developed neighborhoods in this area that have been in place long before County Road 21 extended to the west into Prior Lake. And frankly, it's not that long ago. It's not till the late 90s that this connection happened. And that final connection from 42 north up to 169, that didn't happen until 2009. So really that connection from 169 to Interstate 35 isn't that long ago. But there's been traffic increase out there. There's been some crashes out there as well, so we're monitoring those. The number of crashes isn't that great, but anytime there's a crash on a high-speed roadway, there's a chance that it's going to end up as an injury crash, as we have seen. So residents out there, they've seen that growth. It's the road that they drive the most because it's right in their area. So logically, they're going to pick up the phone and say something doesn't quite feel right out here. Let's have a conversation and talk about what's going on out here. So we did have an open house in November last year, and it was a great opportunity. It was extremely well attended. And so I do want to thank the residents that showed up for that. We had a very good discussion and listening session and education, and that's a really important step in all of our projects in our process, and to understand those that live around those areas, those are neighborhoods north and south of 21 in that area, to understand what they see and feel on a daily basis. And so that was very important, and it was evident from that, as you'd expect, that they want an intersection that they can drive through and navigate, and it feels safer, and they can get out to 21, they can get off of 21 to get home, whatever that is. It's also important to recognize the importance of this roadway. It is a high mobility, high functioning arterial roadway in the county. And in this area, it does carry 20,000 vehicles a day. One of our highest volume roadways. So as a mobility corridor, it's extremely important, not just getting to Prior Lake, to Shakopee, it gets you to 169, it takes you into Lakeville, so it is a very high functioning roadway. We did look at several alternatives out there and presented some of these at that time as part of this open house and this listening session, and looked at several alternatives. We looked at a median closure through that intersection. We looked at what's called a reduced conflict intersection, a J term, as a lot of people know them as. And those, you have to make a U-turn down the road. So if you want to go through from the side street or make a left from the side street, You gotta make a right, do a U-turn, but they're very effective in a lot of locations, on high volume locations like this as well. They're on 169, they're on 42, so, you know, it's a viable alternative. We looked at a roundabout, we looked at a traffic signal, we looked at ITS solutions out there as well. You know, are there some ways that we can give drivers better information to understand kind of what's going on in the intersection? And ultimately, we settled on a traffic signal being the right solution for intersection control at this particular intersection. It does assign you that right of way to traverse through the intersection. Granted, the most of the time, the traffic is on 21, therefore you're gonna have most of the green time. When somebody pulls up on the side street, they're traffic actuated, so it says, yep, somebody's there, they're waiting, it's about time, I think I'll give them a green light. Same thing with those that are turning off of County Highway 21. You're gonna have that left turn signal as well. So it provides that right of way. It will also, in providing that right of way, it will reduce the likelihood of the crashes that we've seen out there. And again, it's not that they're that great, but there's an overrepresentation of the number, or of the kind, that being the right angle and the left turning crashes. So by assigning that right of way and getting the green light to make that particular movement, it'll reduce the likelihood of those types of crashes as well. The traffic signal does fit in well with the corridor and this concept on this arterial corridor. There's other signals on this corridor, so it fits in with that mobility concept as well, yet lets you from the side street navigate through the intersection. It's something that we can install quickly. The roadway is set up for that right now. All the lanes out there are in place, the turn lanes are out there, so we really don't need any road construction out there. It's a matter of getting the hardware and installing that. So we do have dollars that are set aside in the transportation program right now. They're just in a funding category that we are asking to move them into this specific project. There's two things on the schedule, and we fully want to implement and construct this signal as fast as we can. There's two things in the schedule that will impact. One is the delivery of the hardware, the actual signal poles, and the manufacturing of those poles and delivery is in that 18 to 20 weeks out. So as quickly as we can design this, and we can, it's delivery of those, and we will pre-order the poles, not wait for a contractor to get on board and then that contractor order them, that we will do that and we will furnish these to the contractor in advance. The second thing, which we don't know quite yet, which might be longer, is there's utilities through that intersection. Along the east side of Natchez, running up and down there where our signal poles will be, we need location and clearance from those power lines as well. So we will know in weeks here kind of where we're at and if we can position those poles. But outside of those two things, we surely want to construct this once we've made the decision as quickly as we can. So with that, I'll turn it back to Mr. Chair here for comments, questions I'll stand for, and then maybe a couple updates after that on some other construction activities going on in the county.
Thank you very much.
So,
Yes.
Mr. Chair, before, and thank you for doing this, I know we've had tons of tough meetings because of things that have happened out there. But so they can start putting the concrete and some of that stuff as soon as you get this utility, they can start having that stuff in place so that when they get the poles.
Yeah. Yep, that's exactly the intent. So when that happens and hopefully utilities get out of it, we can do the underground work, we can pour the foundations for the signal poles, so when they show up, that construction time is pretty quick. And really, because we're not getting into the road construction, there'll be very little disruption to the traffic in that area while this construction is going on. We've got some ped ramps and push buttons and ADA things that we'll upgrade around the intersection, but really it'd be very limited impact to traffic out there.
And one more thing, I hear this from people, and I have the question, I talked to you about this this morning. You know, we have signals that we take out all over, you know, whatever, not all over, but, you know, like 21 and 13, they just got, can those be recycled or repurposed, and, right?
Yeah, that's a great question. And most of them, that one's been there, I don't know the exact date, I have to believe it's 20 plus years out there. So generally their service life has expired. And so a lot of times you end up replacing a signal, say it's 30 years out or something like that, regardless because of, you know, either it's rusted, it no longer meets, you got different hardware out there, you got additional lanes out there, and once you start making changes to some, it's like, it's about as good to replace the whole traffic signal. So we do intend to put a signal up here that's gonna last for a long time, and Whereas if we did try to do something like that, it might not be as long lasting and we'd be replacing it anyways.
And one more quick. So, sorry, you know, on some of the turns we have these days, we have that blinking little left arrow and, you know, out there, are we gonna have, I'm hoping we wouldn't have that because that's actually the movement that's, we're trying to, whatever, and possibly a sign that says no right on red, something,
Yeah, that's a great question. And we look at all of our intersections the exact same, we look at them individually. So we look at all of them collectively, but then individually at that intersection. So we have flashing yellow arrows for the left turn. That's a permissive movement when you can find a gap in traffic. But you're right, in particular that westbound left turn to go south on 91 has been involved in a number of crashes, including the one on April 1st. So times of day for sure not to have it. And then we've got to make a decision, as we have with other intersections, that we allow that certain times a day. And it might be a very late period of time. It could be, you know, 8 o'clock at night till 5 in the morning or something like that when there's very little traffic on the road. So we'll observe that over time. But to your point, if we're going to help from a safety standpoint in that regard as a traffic signal, we want to be very cautious in how we operate that.
thank you. Yep.
Well, Mr. Chair, when Commissioner Wolf was talking about recycling traffic signals, I thought he was talking about the wooden poles on 13
Exactly,
and
yes,
42.
same.
Those are going over on Conley and 27 and Savage.
So moved.
Those are already
They
spoken
can put
for.
those on a tree that's planted there, or?
I think another city's being heard from here, but
Not the same thing.
Mr. Chair, I'll make a motion. It's Commissioner Wolf's district. I was kind of waiting for him to make the motion.
I thought there was gonna be some discussion, but I would make that motion, thank you.
And I'd be happy to second it, and then just one further comment, if I may.
Yeah,
A serious comment this time. You know, Tony, I don't think there's been a accident investigation's been completed on this last accident, but at some point, distracted driving has to be considered. And I wonder if traffic signals, is there any evidence that indicates that if there's a traffic signal, the instance of distracted driving being a contributing cause to an accident actually goes down because there's a bright red light there, or maybe an advanced warning signal like we do on some of them, you know, prepare to stop when flashing kind of thing. Is that, by the way, is that going to be part of this? At a 55-mile-an-hour highway, an advanced warning signal, you know, prepare to stop when flashing might be useful for that distracted driving component.
Yeah, and those have been effective in locations in general when you're like, you've now gone, you're coming into an area that, you know, is signalized. So it's been 20 miles or whatever that is, you're out in a rural location, you're approaching in, you know, into a city and it's the first signal. And there's signals on both sides of this, granted they're miles apart.
Yeah.
But you're in that corridor and that mindset
Okay.
that this is a signalized intersection, I've got to pay attention. In those other locations, they have been effective, and there's been several locations like that. But again, it's usually on the outskirts as you're coming in and hitting just that first signal once you're getting into town.
Jordan and 169 comes to mind. That's very helpful to have that advanced warning there. But, okay, well, I just wanted to know if that had been considered here. And again, people, if you just pay attention, a lot of this wouldn't happen, wouldn't be necessary. So thank you. With that, Mr. Chairman, I think I did second the motion.
And did you have a?
Nope, I'm ready to go. Let's get her up.
Well, I just had a couple questions before we vote, which won't impact that, but just to, because it is such a big deal, roundabouts. I know that was looked at, and I think there was some chanting at one point in an open house, but I've heard on this particular intersection, people that want a roundabout, and an email just flashed, that people don't want a roundabout. So maybe just a few seconds on?
Sure.
Just since we're talking
Yeah.
about it?
Yeah, it is, I mean, you do hear both sides, okay? And we have several in the county. I mean, we've got quite a few, actually. And they've been very effective. Our rural locations that are a single-lane roundabout have been very effective. We installed the first rural high-speed roundabout in the state of Minnesota at 13 and 2. And that's been very effective. But I do remember when that went in initially, too, you know, people driving right over the top of the thing. You know, so it's, you know, traffic engineering is all about risk management. There's not a one-size-fits-all. A stop sign or an all-way stop might be good someplace else, a roundabout's good someplace else, and a traffic signal is the right solution in a different location. So even the other one down in New Market Township, we had somebody last year, southbound running right over the top of that one as well. So to your point of distracted driving, you know, it's not foolproof. The fatality that we had last February 2019 ran right through the stop sign, didn't even stop, and T-boned a car.
Right.
So you know, no matter what was in place at the time, if it was different than what we have out there now, and there's lots of signs. There's a stop ahead, there's 2 stop signs, there's pavement markings. Something happened. Somebody wasn't paying attention. So no matter what you have out there, it's not a one size fits all. So a lot of the solutions that you try to come up with, oftentimes there's unintended consequences. You put in a signal, all of a sudden you've got rear end crashes, you know, things of that nature. So it's not foolproof.
Right.
So, but we think this is the right decision for this location. The jury's still out on a location like this, which is very unique. So to put in a 2-lane or a 2-1 roundabout, because you don't need 2 lanes north and southbound going through this intersection, on a high volume, a high speed location. And so there's some counties and agencies that say we simply wouldn't put a roundabout in there, just as a matter of fact.
Right.
That they simply wouldn't do it. And we look at this corridor the same way, that we don't think it's the right solution. There's the balance of traffic is like 6 or 7 to 1 compared to the main line to the cross street. So you're gonna get people fast pathing through there, if you will, because they know there's nobody that's gonna be entering in there most of the time.
Right.
So, and if you got nobody on your left or right, I'm using 2 lanes to bomb through there. And so you start to introduce other safety problems if it's not the right solution. So we look at this location as, and I'm a big roundabout guy, so I know others, you know, they like them, some don't like them. For the right location, I think they're effective. And we've got another one going in next year down in north of New Prague. So they can be very effective.
Well, I just wanted to ask the question because more than one occasion I would meet with a private party, a city or whatever, and oh, this makes so much sense, you know, and then go, I'm thinking of one in particular, I had a meeting with Leslie, oh, this makes so much sense, and I sit in her office and she schools me on, well, here's why that doesn't work. You know, I'm not a traffic engineer, nor do I play one on TV, but, so I just wanted to ask the question that this has been looked at, and this is not a silver bullet. You still have to pay attention, because you mentioned the February last year, right?
November last year. When
November, that was a running through a stop sign.
Yeah, I'm sorry, February of 2019, the crash was, yeah.
Yeah, not the most recent.
Yep.
So the light isn't necessarily, hey, you don't have to pay attention. You still got to pay attention. I mean, I tell my kids, pay attention all the time, but definitely in that intersection, and that's not going to change whether there's a light or not. Just pay attention.
Driving a car is the most dangerous thing that we do in our regular day lives.
And when the light turns green, look both ways to make
Oh,
sure that
man.
somebody isn't
Yeah,
trying to
it
get
just,
through quick.
Thank
Yeah,
you.
that's- Right?
Yep, green light's permission to look both ways.
So, my other question was, you know, sitting here today, you know, you guys feel that this is the best solution. You already answered that. So, we have a motion. We have a second. Let's get this thing moving.
I just want to say one,
Yeah.
Chris Kostick, the chairman of the Credit River Board, he's been instrumental in helping us along a lot of conversations, and they're fully in support. Their board there, they've been great with this, so just wanted to put that out there, so, thank you.
And this has been on the books so this wasn't some knee-jerk,
Right.
I mean, this has been, something that's been studied and looked at for a long time. So, motion and second, I see Deb is ready to give us a roll call. Thank you, Tony, for that part of it. Do we want to vote and get this through, and then we'll get a little bit of an update? Let's do that. Let's go for it.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye.
Thank you very much. And now we're gonna have Tony back for a bit of an update on construction around the county.
Sure, I can mention a few projects here. So we've got a couple that are going to be starting up quickly here. County Road 42 expansion, that's from County 17 to 83, the 1.5 mile section. A lot of trees were taken down on Friday. Road construction is going to start this coming Monday. So signs are up to let people know. That will be a full closure. So we've got detours set up for that until August. So we've got a lot of deep cuts in that corridor. Obviously, we're widening that corridor, and we need to move dirt from east to west, and so there's a lot of activity going on from now until August. After that point, then it will be opened up from 17 to Dakota Parkway, and that will remain open, and we'll continue working. And this is a full season project. It's a lot of work to do out there, and granted, we don't have to deal with a lot of residents along there. You got a few people that we've got to maintain traffic to, and that won't be a problem doing that. But it's a big project, you know, expansion and ponding and things. So that will go right into November, you know. So it's like, we'll see how weather goes. We got it, you know, obviously the weather's been better this year already. But it could be that the final lift, so the final wearing course of the pavement might happen next year. We'll make that determination as we get into the fall. So you'll see lots of activity starting next week on that one.
So the folks, I mean, yeah, there's not as many homes, a business that I can think of. I mean, obviously the casino, that one entry point, but, so they've got access, or you have to keep it?
We've got to be able to maintain an access to them. It might be, you know, along our future trail on a gravel road or whatever that is, but we've got to maintain that traffic the whole time. We just simply can't isolate someone.
And we've got a process in place to
Yep.
communicate that to those folks
Yep.
in the business, so there's no surprises
Right.
or very minimal?
Yep.
That's a big deal.
Yep, yes, it is. We
Okay.
definitely have learned that over time. That's one of the biggest things, is that communication out to the residents and the businesses in the area, so. Down in Elko New Market, okay, we've got, speaking of roundabouts, we're gonna be constructing a roundabout at County Highway 2 and 91. And this was a city-led project, and we're administering the construction contract on that. And that's gonna start in 2 or 3 weeks. And when that gets going, they will have a 10-week window to shut that entire intersection down. And again, we've got good detours for this particular project. We've got a nice 2-mile grid system out there. You can use County 62 on the north and 27 on the west. You got 86 on the south and 46 on the other side of the interstate. So we've got a good detour routes for people to find their way around. Granted, there's not a lot of people on the road right now. So that'll be, you know, they'll have that done and open to traffic before Labor Day, before school starts up. Hopefully we're starting school up come Labor Day. So that'll be another pretty fast track project. So yeah. Going over to 16941 County Road 78, the big interchange project. Got a ton done last year. Our County Road 78 is essentially done. The frontage road, Louisville frontage road is done. The ponding on the project is 95% done. They're touching up out there if you go look right now, so there's a little bit of grading work, but those are mostly all done. So they are building the bridge over 4178 right now. So you see they're getting ready to pour the bridge piers if you go out there. So the traffic control that's set up there right now is basically a right in, right out off of either 78 if you're on that side of the roadway, or if you're 41 on that side of the roadway. So there's no means to cross through there.
Right.
So you do have to take like the frontage roads and such to get back to those locations. So that work will continue on until the first part of August. So building the bridge itself, building the mainline approaches on 169. So there'll be a lot of work you'll see continuing going on there. After that point, and we switch traffic onto 169, then we'll close 41 for a 1-month period. So that'll be closed in its entirety so we can build that roadway out as well. So that gets us to mid-September timeframe. There'll be some cleanup after that. So, you know, come October, it's gonna look like a full interchange project. So that's a big game changer out there. So they made some good headway, and there'll likely be, anytime you have a project that's this big, it's likely that there'll be some cleanup work of some sort maybe into 2021, but not a lot of work there. And then maybe lastly, talking about the Prior Lake project.
Before we
Yes,
move
Mr.
on to
Chair.
that one, I mean, there's a lot of moving parts. There has been, there will continue to be, and there's a lot of businesses in that.
Yes.
So how are we doing, in your opinion, with, I get it,
Yeah.
it's a big project, stuff
Right.
comes up where you weren't expecting, but how are we communicating? Because I hear a little,
Yep.
you know.
Yep. So again, that's such
chattering.
a big part of what we have to do, and sometimes we do have a misstep out there. It's like, we didn't alert somebody when we made some sort of traffic change or their access change or whatever that is, and lesson learned every time we do that, that we have to stay ahead anytime we have changes out there to the residents and the businesses, you know, out there. So we do have, so MnDOT is leading this effort. They have somebody that is their communications liaison. And so she routinely, like the Prior Lake project as well, that people have signed up, they get the weekly either email or a text letting them know on a regular basis, I think it's every Friday on that project, that goes out. Or when there's additional traffic control changes that might affect them, they'll get, or anybody on the quarter that's subscribed to that, they'll get a notice of that. You know, it may direct them to the website, so then they can get more detail when they go onto our website to find out what those pending traffic changes are.
Well, I know that makes it tough when you got so many cooks in the kitchen when it's this person, it's that person, it's
Right.
that. But that communication is only going out weekly, right? That text?
At a minimum, yeah, that goes out at a minimum when there's, you know, just to update people what's going on.
Right.
Anytime there's a significant change that would affect, you know, access or traffic control, then an additional blast will go out to let people know that there's a change that's gonna happen.
And we're on top of that?
Yep,
Because, I mean, I get it.
yep.
This
We-
won't be
we
our
have-
first big project.
We have we have had some where it's like, you know, somebody got missed out or, you know, wasn't quite communicated as greatly as, you know, we wanted it to be, or somebody misinterpreted it one way, whatever that is. Okay, but yeah, on any project this big, we hear, it's not an excuse, but I'm just saying, you know, once in a while, it's say, I didn't know that this was coming, you know, and sometimes it might even be the other way. You're on the email list, you get it, you know, and sometimes it's us, it's like, we didn't send that out in a timely manner to alert people.
I just,
So.
you know, we got a project south and north of there that's gonna be, so yeah, we're learning. As long as we're learning, that's,
Yep. Lastly, downtown Prior Lake.
Yes.
Again, we were very lucky last year. We got ahead of where we thought we would be.
yeah.
And so they're taking care of storm sewer and water main right now. If you are able to kind of get close enough to take a peek and see what's going on, probably still see some concrete pipe laying around. So they're finishing that up. You will see curb and gutter start to be in place here in a couple weeks. They'll start to pour that. Arcadia intersection will shut down next Monday, and that'll be closed for a 3-week period. Main Avenue will still remain open, but Arcadia will, and the roundabout's done, the pavement through there, but there's a lot of concrete work and cure time and things like that that have to happen within that intersection. So that's gonna close down for a 3-week period starting this coming Monday. And then, once that curb and gutter, visually starts to really take shape. Once you start putting curb and gutter in, you kind of visually start to see some things, so. We have targeted all along July 10th as a date of opening. We're quite confident because we got a good jump this spring. We had a little hiccup with a snowstorm last Sunday, Monday.
Details.
Kind of lost just one day there, but overall, we've had fantastic weather. And so we think we're in really good shape out there, and, you know, we're hopeful that'll be before the 4th of July, but I'm officially saying July 10th. But we sure would like to be open before the 4th of July for the downtown area.
Well, last fall was super helpful, getting that.
Yeah.
And then what about Duluth? When will
Yeah,
that,
so that'll be, that's coming up as well, so, yeah.
does that have to be closed, right? Because they're putting that right in, right
It
out
is,
there?
yeah. Yep,
Okay.
so that'll be, that'll be a 3-quarter access, so you have a westbound left turn in and a right in, right out in the eastbound direction, so, yep.
I just, quick, you know, with all these big events that are going on, this might have been answered with the previous speakers that, you know, I'm worried that they might not be able to get into some, if the Lakefront Music Fest or the.
Oh, that's-
Renaissance. But if, what I'm hearing from Dr. Wilcox and the people, Dan, he's not here, but those may not happen this year.
Right.
So.
Yeah, time will tell. We've had, if anybody's listening in on this, the support that we've gotten, especially in the downtown area with residents and businesses and the city. Prior Lake's been fantastic, their staff and mayor and council members really have been fantastic working through this. You know, we got great compliments last fall as we were kind of buttoning up the project, that it went swimmingly and really had, you know, it went quite well. And getting out there as early as we did this year, really the same thing. You know, we've gotten some good feedback, and quicker we can get it open, the happier everybody's gonna be.
Yeah, very, very different project, different size for sure, but I've heard very good things on communication with the 2113, which is,
Yep, and again, we have a
It's awesome.
designated community liaison for that. So last year when this started up, we had the Trunk Highway 13 MnDOT's project, there was a Duluth project that the city was leading, and then our project. So there was a ton of activity going on, so people could really be communicated to and really understand where they're going and how to get in and out, and so I think it's went quite well.
yeah. I agree, and I've heard the same thing on that. Anything else?
I think that's it.
Yeah.
Those are the
Mr.
kind
Chair,
of big ones.
Tony, I was just going to pass along one thing, and speaking to one of my utility friends, they had been expressing some frustration in trying to work with all the construction that's going on. It's not just our county; it's all over the metro, And relocating utilities has been a problem in past years, and he was lamenting the fact that finding labor is difficult. It's complicated equipment sometimes to locate and pick up and move, and a cable or a fiber optic line, you just don't go out there and do it on a Friday morning. And they're getting behind, and just he I don't think excuses was the word. He was just expressing that they'd like to keep up, and they're frustrated that they seem to be impacting some of our reconstruction projects because they're using the right-of-way. I believe they use it free of charge, but the downside is whenever we want to reorient the right-of-way, they have to move their stuff at their costs. And so they're trying to do that, but running into trouble with subcontractors that lose employees, or just get tired of being in business and go out of business, and things like that are happening all over the place. So I don't know if this COVID-19 thing is going to have an impact on that with the number of employees that might be available this year in this construction season. But are we catching up with that at all, or is it still kind of a?
It's definitely still an issue.
It is, okay.
In general, it's business as usual. So the executive order 20-20, when that first came out, basically said, construction's a critical service.
Yeah.
And so our projects are moving along, you wouldn't know any different, except that how people kind of conduct their businesses. Meetings, might not be in a trailer, they're outside, one person in a vehicle, things of that nature. But as far as contractors and inspectors and such moving forward, it's business as usual. To the point about the utilities, that's been a long-standing and kind of a growing concern. So it's a tough, and we try to work with the utilities like years in advance when we have a project. So there's a highlight, it might be as far out as 2 years. We've got this coming up in a couple years, start to think about it because it's coming. And then as we get into our design phases, we have utility meetings throughout that design phase, so they know exactly, what's out there. And it's super important to us. And some are more responsive than others because we have to understand what's all out there. And you have some vacated utilities, and in some sense, it's really a mess. Because you don't know exactly what's out there. Then the contractor gets out there, and to your point with, different ownerships and things of that nature, things get difficult because sometimes they may not have, all of their information understood as well. They may have abandoned lines, and they may not know exactly where they're at as well until we actually get out in construction. And now it's a real pinch, for our contractor. So they're impacted. They're expecting that those utilities are already moved by the time they want to get at the road, and the utilities haven't even started yet. So it's a huge industry issue right now, and even more so if that becomes an issue with labor for those utility companies.
All right, thank you for that update.
All right.
Appreciate it. All right, we're going to move on to committee reports and commissioner updates. I'm going to look to my right.
Great,
Commissioner
thank you.
Workman-Rucky.
Since our last board meeting, let's see, April 7th, I attended the Jackson Township Board meeting with Perry Mulcrone from Scott County and Steve Herman from Access to talk a little bit more about the what we approved at the last meeting, the cost sharing with the townships and Access. Ultimately, just in the last couple days, 2 of those agreements did come together, one with Jackson, Louisville, and the city of Shakopee. Actually, all 3 jurisdictions ended up participating, and the other was Spring Lake and Sand Creek Township. I think Newmarket opted to do something else, but a lot of communication over the past 2 weeks with those jurisdictions. And Perry's really done a great job pulling that all together and pulling together some very important but localized resident requests. We have some residents who just don't have broadband access and aren't able to work from home, and he's really worked with the private providers to get them some kind of access. So it's been good. April 8th had a Scott County Historical Society board meeting via Zoom. Really interesting to hear about the creativity of these nonprofits, something like Scott County Historical Society. They can't have their programs open, can't have their building open, but doing a lot to promote local history online, especially helping with K-12 education and so many of our kids at home, giving ideas to parents on projects that can be done, and some walking tours in our different communities. So that was interesting to hear. April 9th had a remote meeting of the We Can together. and Child Abuse and Neglect in Scott County Subcommittee. April 14th, a phone call with the Belle Plaine Mayor and City Administrator about County Road 6. Again, you know, these transportation issues are hard when there's different jurisdictions involved, different funding, different timelines, so needed to touch base about that, and most of the misunderstandings were figured out by staff before that call, which was good, so that made it easier on me. Also on April 14th, had my monthly meeting with the county administrator. April 16th, we had our first MELSA board meeting remotely, and approved some budget movements to put more money into e-books for the whole region, because that's becoming so much more important. Heard about other libraries. We were really ahead of the game in getting curbside pickup up and running here in Scott County. Just kudos to our library staff for getting that going, and it's been extremely well used since we've had it going. And just the ability of the library to be providing resources to all these kids at home and parents teaching has been a big deal that I think people forget what an important resource that's been. Also that day, April 16th, had a call with Angie Craig's local staff member, Julia Bartusik, about county funding and the most recent bill, federal bill, and making sure that that county funding is not just limited to cities and counties over 500,000, and making sure from our perspective that funding should really go directly to counties. We don't want to see that funding coming through the MPOs. That just doesn't seem very efficient. April 17th, had our first Dakota Scott Workforce Development Board meeting remotely. Went well. You know, that's a tough subject right now, hearing about the number of people unemployed in Scott and Dakota counties, but also hearing some good news from folks who are really trying to, there are places hiring, and that's hard, because some people are unemployed and they're gonna wait for their jobs back, but for the folks who are looking for jobs, there are people hiring. The Workforce Board with Career Force put on a virtual job fair a couple weeks ago, and there were a lot of companies hiring. So that's the other side of the coin. April 18th, Saturday, participated in the NACO call about county funding, and this morning, before this meeting, participated in the Shakopee Chamber of Commerce virtual coffee hour with Senator Pratt and Representative Tabke. Other calls and interaction, especially the last week, once the broadband stuff calmed down, the last week's been hearing from folks about opening up the economy, what's our role, what is our opinion on that, and a lot of what we discussed already, but I think some of the frustration from our businesses, you know, maybe in Shakopee, Jordan, Belle Plaine, New Prague, there's businesses who are shut down because they're not essential, but their competitors, you know, Walmart and Target, who've always been their competitors, are open. People are congregating there. Lots of people are there. There's some people who feel like, well, we could offer our services and our products much more safely than those larger environments too. So, so I think that was a lot of the conversation this morning with Senator Pratt and Representative Tabke. Really hoping that it's maybe, and I think we know this is coming, it's going to be a move from essential versus non-essential to, can this be done safely or can it not be safely? So I think we have a lot of moving parts in the next couple of weeks that we will try and adapt to.
Yep, I agree with that. Thank you very much. Look down to my left, Commissioner Beard. I'm just gonna put, well, Commissioner Ulrich go after you, just to put him on notice so he's ready.
All right, good. On April 7th, I attended the CAP Finance Committee meeting. These were all Zoom meetings that, for some reason, Zoom seems to work really well on my setup where I struggle with the Skype thing. So I'm glad some of these NGOs are going to Zoom and able to work with that. The finances at the CAP agency are in a pretty good shape. We're working with a nonprofit that we partner with in Carver County, Bountiful Baskets, I think it is, a food shelf, volunteer nonprofit food shelf. Their service is up, but their donations are also way up. And there, so we had an interesting discussion about how they're doing that, because Cap Agency Food Shelf is being, demand is up, of course, but our donations haven't outpaced demand like they seem to be doing at Bountiful Arms. But it's just good to know that people are paying attention, people are pitching in to help where they can, and Cap Agency finances are in good shape, and Jeff Hansen, the new CEO out there, is doing a fine job. On the 14th, I also attended the Cap Agency board meeting, again via Zoom, where Jeff, the new CEO, introduced the truck that was donated to a local company. Donated an entire Mercedes van and outfitted it in a wrap for Joe. Blanking on his last name.
Vaughn.
Thank you, Joe Vaughn. Yeah, the Joe Vaughn van. His wife helped design the wrap that was donated again by a local industry, and so for no charge, the delivery truck, which is participating in meals to shut-ins and people who are in quarantine that need help, that vehicle is beginning to run around town. So when you see that truck, know that somebody out of the goodness of their heart and the generosity that they've been given, they've shared from that prosperity and
Awesome.
gave that to the agency. On the 13th, also I had a little Zoom coffee with Senator Pratt, and we talked about the bonding bill going forward and where some of our county legislation was in St. Paul, and just kind of the lay of the land. It is so strange over there this year. A little exchange with Representative Tabke about watching him speak on the floor of the House, and there were like 15 people in the chambers. And I thought, where is everybody? Well, they're in their offices or they're in cars in the parking ramp, voting electronically. It's just strange, just a strange time over there. And I said, well, I miss you guys. How about I come over and see people? And they said, probably not. Unless you have a direct invitation or an appointment, you can't even get past the lobby of the building.
Oh, geez.
So I thought, wow, that is a different time. The MICA, I missed the MICA board meeting update. Perhaps Commissioner Ulrich will update, but just a couple things that I want us to think about, particularly for our road budgets. The gas tax revenues are down. Amazingly, they're not as down as much as seemed to be indicated. On the charts that we just saw, it looked like 30% less travel, but gas tax is only off like 4 or 5% at the moment. What's really taken a hit, though, is motor vehicle sales tax. All of a sudden, people are not buying new cars, and that's a big deal, because that is 60% of that money, of course, goes into the Highway Trust Fund and circulates back to the counties, and 40% goes in the Transit Fund, which at the same time, transit use is way off. Maybe more about that at another time. Another thing that is in decline are tab fees and registrations. You'd think even though people are holding on to their cars, apparently there's cars being parked and the license tabs aren't being renewed. So that's off a few percentage points as well. Our county state aid for this year is intact, but 2021, there may be some adjustments. So just so we're paying attention to that. And I can hardly wait to see how the Scott County Transportation Sales Tax revenues are going with our three biggest generators, Mystic, Valley Fair, and Canterbury, all on hiatus. That's got to have an impact on what's happening here. Perhaps we'll hear more about that in a moment from the county administrator. And the last comment I have, Mr. Chairman, is you had sent out last week just a note from the chairman to all of us and to all of our staff. And I just want to say thanks for doing that. That was uplifting and I think spot on about the sentiments of the board towards our staff and towards the citizens we represent and serve. Thank you for that letter.
Thank you. Commissioner Ulrich.
Yes, thank you. On the 8th, MICA, and Commissioner Byrd, you actually were on that call. We had about property taxes, and it was kind of interesting, the question, will we forgive some penalty for late payments?
I remember this discussion now, yes.
One commissioner wanted, what about me who's going to pay it on time? What kind of incentive should I get then for paying it on time? I thought that was kind of a weird comment, but everybody is discussing, the idea of should we forgive some late payments or late fees for paying property tax late or whatever. And I know we're going to be talking about that coming up. So that was a key conversation there, Mike. on the 13th Greater MSP, and also had one on the 17th Greater MSP. One thing I want to say is that projects are on a pause. A lot of projects were in the works that were progressing full steam ahead are now paused, and so that's to be expected. One conversation that came out of Greater MSP, but I don't want to attribute it strictly to Greater MSP, but it's the idea that we should be outraged and probably angry at companies that have been making critical things overseas. For example, masks or medicines, and now they're being held up in China. About 60% of our medicines are made in China, and I know major Minnesota companies that are making a lot of protective equipment in China, and now China's holding up these goods that are critically needed in the United States. And so we're asking, what's going to be the new normal? What will our society tolerate or accept in terms of manufacturing critical things that are needed for our country that could be held up by other countries if there was a crisis or a war or whatever? We need to be, in some ways, self-sufficient on some of these critical things like medicines and protective equipment, and have them made in the United States. And I think this whole new normal is going to look differently in what we will accept. You go into a retail store, major retail store, and you buy something, for example, you might find 10 varieties of it, and yet they're all made in China. Is that something that we're going to continue to accept in light of this crisis? There's going to be a new normal. And I think a lot of manufacturing, especially of critical things to the health and safety of our country, are going to come back into the United States, I would predict. And so we had some of that kind of conversation. The 14th CDA, we had a conversation about Elko New Market in terms of the help they want with infrastructure and with a business park and so forth. And obviously with the business climate on pause, that probably has an implication for Elko New Market and the speed at which that initiative might progress. There is a task force that's been working on the sort of the groundwork or dynamics of that. Stacy Craigs has been working with that and heading that up. I would recommend that at some point in the next few months we receive a report from Stacy in regard to what the task force has been working on and what that might look like. My recommendation there. On the 15th, the tab, we talked about should there be more or less applications in this time for solicitation, regional solicitation. And my statement was, we could probably predict that there's going to be a major transportation funding, federal bill funding, just to stimulate the economy. I know President Trump has mentioned $2 trillion infrastructure bill. I don't know if that'll ever happen, but we might expect some big money coming to our region, maybe some different things relaxed, like the match. Maybe that would be less of a match that's required. So I was just encouraging us and others to get as many applications in as we can to position ourselves for new money that might come into the region, similar to ARA in the past. That was funded a lot of major projects in the Twin Cities. And so that's a dynamic I think we're facing. And then the 17th, another Greater MSP meeting. That's into my report.
Thank you very much. Commissioner Wolf.
Thank you, Mr. Chair. On the 8th, I had the MESB, Metro Emergency Service Board meeting. A lot of talk about the virus and what's going on with that. On the 9th, the I-35 Solutions, just a short meeting there on the Skype. That evening, Elko New Market had their monthly meeting. Kind of a short meeting because it was all on the television or on the phone. Spring Lake had the same thing. They talked a lot about that internet and the connection out there. And they are probably going to do it. They gave the chairman, Ted Kowalski, the authority to kind of make up his mind if they got all the things they wanted out of it and whatever. So I guess I was a little disappointed that New Market was going to pass on it because there's a number of residents out on that. They're east of 35W, or 35 actually. They have not much out there, and some of them, some people think that's Dakota County out there, but it is not. It's actually a very good commercial area of Scott County. On the 13th, we had our Muriel meeting, and we actually picked a a person to do an artist to do that painting. We're gonna be meeting with him next week, I think sometime, or maybe even this week. But he's got some really nice designs, and it was a really tough decision, a lot of good stuff. Excuse me. Then Credit River met with the chair yesterday about the 21 and 91 there, and some of those, what was going on there. He, hadn't seen the whole agenda yet, so very happy with what's going on there. Talked with the mayor of Elko New Market, and he's concerned about this, the plan with the CDA, and he hopes that even though things are slow, that it would be a good time to get this thing going. Maybe there would be some cost savings in doing it now. So I'm hoping that can be worked out. And Commissioner Ulrich, you can relay that information too if you'd like. Then Prior Lake City had a short meeting yesterday. Credit River had a couple meetings with neighborhoods who they were repaving or just refurbishing the roads out there. Some of them are falling apart. A couple of concerned residents that now's the economy's down, and some people are out of jobs, that would be a bad time to throw a $3,000 assessment on them. And the tough thing is, if we let some of these roads go a year or two longer, they'll need a full replacement, and that could be, instead of $3,000, could be $10,000 to $15,000 per resident. And I think you got to fix the roads now and keep them in repair. And if we can do it now on some of these roads, that we'll get another 10 or 15 years out of them rather than 3 or 5. And so I'd be in favor of that. And plus, that the bids that we got on that Credit River got on some of these were very favorable. So it's I think it's a good time to go ahead on those. And just a couple other meetings here and there, like everybody else, with local elected officials and whatever. And so that is my report.
Thank you very much. Yeah, some of these dates, because there's a lot of these calls and meetings are coming fast and furious, but I think it was the 11th. I've always heard about Esperanza. I'm familiar with Rock over in Prior Lake, and I always hear about Esperanza. I'm like, all right, I'm going to go check this out. I was looking for an opportunity to fly a drone too. That might have been part of it, but I went over there under high wire, so I didn't fly. What an awesome opportunity for people helping people. And cars were lined up, but man, were they moving through. They got people in and out, giving boxes of food. So, I mean, Esperanza is just the one I happened to go to, but we had Lisa gave us that chart earlier of all these different groups and people, and the countless others I think was mentioned, families and individuals that are pitching in, getting the job done. So, just so awesome to be a part of this community. On I think it was the 15th, had an AMC Metro County conference call regarding property tax and other concerns. I think also that same day, the White House Intergovernmental Affairs Office had a conference call with all the different department heads, giving some basic updates. A lot of it, you hear it on the news, but I wanted to hear it from the sources. That was helpful. And I don't remember, you said the 16th was probably in that same time frame, 16th, 17th, trying to work the calls with our senators and our congresswoman. And I mentioned earlier that Angie Craig's office is very responsive, whether it's the local office or her texting back directly. Senator Klobuchar, I had 2 calls from her staffers. And then Tina Smith, I still have not heard, so I don't know if you guys, and I'm trying to throw in her bus.
Same experience. That was my same experience. I several calls with Representative Craig's office nationally in Minnesota, 2 from Klobuchar's. Nice to have good contacts there. But
Yeah.
nothing from Smith.
And this is not a blue, a red, a green, a white. I mean, we need that relationship to try to get some work done here at the county. Same thing with St. Paul. So this is not a political statement. Those are the folks that have been elected, and we need to work with them, and we need their help to move some of these items that we have at the county that are important. So not having any kind of feedback, even an email, is a little disheartening. So thank you to the others that have stepped up. And locally, our representatives and state senators have been very responsive, I think, to all of us, certainly to me. So I just want to thank the board, because I know we're making those calls and taking advantage of those, I shouldn't say taking advantage, but you get what I'm saying, of the relationships that we have there to make sure that our needs in the county are being heard in St. Paul and beyond in DC. So thank you for that good work. And I also wanted to say, once again, thank you to our staff for being resilient, being flexible. The work does matter. It is getting done. We've got a mission, we've got a calling. I think most of us in the county staff have a calling, and they're living that out, maybe just in a different area. But thank you for being flexible, and continue, because we're going to need continued flexibility in the foreseeable future. And again, wow, the human heart is just bursting, not only in this community but elsewhere. So for all the people that are doing good work, giving out of their abundance, and maybe even giving out of their lack of abundance, is inspiring and encouraging. So it's really heartening and inspiring to be a part of this community. That is my report. I am looking over to, oh yeah, that's right, you got to make the trek, looking to Leslie, our county administrator, who has been social distancing out in the speaker area. Are they more comfortable chairs out there? Be honest, are they more comfortable out there?
No, I think yours are far more comfortable.
Thanks for being flexible as well.
Thanks, Mr. Chairman and Commissioners. Just a couple updates. So as we're heading towards, May 4th, and you read the federal guidelines for rolling out, it's still pretty clear that teleworking when possible should be done, and social distancing in small groups. So as we start to look at that, we're starting to put some of those plans in place. Things like the library, how can we do computers by appointment if we're not opening the whole library up for people to congregate in? Things like passports and driver's license being done by appointment, so we don't have 25 people standing in the hallway within a few feet of one another. Even with the dots we've put down, you can still get folks too close together. So it's those types of things that they're taking a look at. I just got an email from Brad Davis about household hazardous waste, and there's going to be a backlog and setting up appointments to bring things out there as well. So everything, I think, from zoning to planning to building, all of that will probably go to some type of by appointment. And I'm not so sure in some ways, especially when you look at the DMV, that it's not more efficient for both the residents and for our staff than just standing around for an hour and a half. If you know you can get in and you're going to do your work in 20 minutes, 25 minutes and be out. So I think there's actually maybe some benefits to some of that as we continue to look at it. The other thing, Commissioner Beard brought it up. I spent an hour yesterday with Highway because theirs is one, and obviously Health and Human Services as well, as we look at their budgets and their revenues. There are several of theirs where dollars are down as well. But Highway is a big one. And part of what Commissioner Beard saw, I think, in the MICA meeting, and that I walked away from the MICA administrators meeting, you were still seeing some of the revenue counts from February and into March. So as we're looking at what MnDOT and some others are providing, remember the Highway User Trust Fund is made up of gas tax, the sales tax from the vehicles, and then the tabs. So sales tax is down and gas is definitely down, right, as we've closed the state, and probably will continue to trend down as some of these activities don't continue over the next few months. So we're actually estimating from our gas tax or the Highway User Trust Fund probably a decline of 25%. So in highway maintenance, that's about $1.1 million in our operational fund, and closer to a couple $1 million in the construction. The bigger concern to me, though, there gets back to that motor vehicle lease sales tax that was the agreement with CTIB and those types of things several years ago. If the Highway User Trust Fund is down that much, how are they going to let 5 metro counties and some external transit take all of those dollars? I am much more fearful they will put that back into the larger distribution to try to make up for the downward trend in the Highway User Trust Fund. So we're modeling it getting 0 and modeling it continuing maybe at 50% to try to see what that means for projects moving over as we're having that discussion. But that one is a little bit concerning. We do know, as Commissioner Beard said, that the gas tax is good for this year, what we were deemed to get. The sales tax, We're guessing somewhere, Hennepin had actually been doing some modeling in that 50%. You know, we've been getting about $10 million a year in sales tax for that fund for roadway construction. So Lisa and her team are taking a look at like 50%, and what does that mean? We still believe, because it was running higher than we anticipated, we can continue the projects we had originally planned. It doesn't, though, give us much. You know, we'd hope maybe to have some for like 282 and 169 or something like that. Those types of things probably, it doesn't allow those types of funds for. So yeah, we are doing some modeling. We have a meeting tomorrow afternoon with all of the senior leadership to look at that. Danny Lenz, the CFO, and Steve Jones have been doing some modeling on what they're looking at. And then, of course, the other big one is the county program aid, which is out there, which is about $6 million to the county. We'll have to continue to monitor the state. You know, we know their surplus is gone, but that also is an important part of our budget revenue is our county program aid. So we are taking a look at all of those types of things. We also put a hold on several CIP projects, capital improvement projects that you had approved. We're not purchasing the vets van at this point. It's about $70-some thousand. Some technology in one of the courtrooms has been put on hold. The ATMS work for the signalization of the software, we're continuing to put the fiber in. So at some point, if we could release the software. The sheriff's body cameras, which is one we had been hoping, and then some work at Blakely. But when you take a look at all of those, you know, it's well over $750,000 that we're saving there by putting those on hold. If things progress and look okay, we could slowly allow some of those to happen then over time. But right now it's there if we need to save those dollars. The other thing is we have frozen all vacancies, and we're modeling what that looks like over the course of the year. You know, there's a couple in dispatch or sheriff's patrol that if the numbers get so low, we'll have to refill some of those critical services. But otherwise, all of the vacancies are on hold and modeling what that savings looks like, as well as any travel and training. So those discussions are taking place, and we are taking a look at those. Tomorrow we have several hours set aside to take a look at some of those models and what it means. And then other than that, we have the 2 work sessions after the meeting today to get some direction from you on a couple important topics as well. So otherwise, if you have any questions.
Thank you very much. We'll see you real soon. Thank you. Looking down to my right, Mr. County Attorney. Anything?
We do not need to meet separately.
Thank you very much. Appreciate that. Brings us to item number 11, adjournment.
Motion to adjourn.
Motion.
Second?
We have a second. We have a motion and a second and a little laughter. Any discussion? Otherwise, roll call us out, please.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye.
All right. We are adjourned. Thank you.